Welcome to the presentation on chronic obstructive pulmonary disease. At the end of this presentation, please navigate to the exam for chronic obstructive pulmonary disease and complete it to the best of your ability. What is COPD? COPD is a progressive lung disease that over time makes it hard to breathe. Typically occurs in smokers, but may also happen with other environmental exposures and hereditary conditions that involve lung tissue damage. COPD is a chronic without a cure and is often preventable and treatable. COPD facts. 11 million people in the United States have COPD. It develops slowly and is not contagious. It is the third leading cause of death in the United States, and currently there is no cure. Causes. Exposure to pipe, cigar, or other tobacco smoke. Exposure to secondhand smoke. Exposure to heavy air pollution. Exposure to heavy dust. And exposure to chemicals or toxic fumes, or a genetic condition could all be causes. Warning symptoms of COPD. Increasing shortness of breath, increasing coughing and wheezing, or a history of a fever. The warning signs of COPD are increased wheezing, a decreased pulse ox, fever greater than 101 degrees Fahrenheit, increased pulse greater than 100, decreased pulse less than 60, and an increased respiratory rate. Diagnosis. Clinical symptoms, chest x-ray, and lung function tests are all used to diagnose COPD. Treatment. Eliminate exposure to the things that are causing COPD. Quit smoking. Exercise and pulmonary rehabilitation. Medications to open the breathing tubes or decrease the inflammation. And oxygen treatments. Medications. Prescribed medication can come in many forms, such as inhaler, tablets, or liquids. Meter dose inhaler, abbreviated MDI. Aerosolized medicine in a canister and a plastic holder, and some inhalers also use a spacer. Meter dose inhaler with spacer use. Remove the cap from the inhaler and from the spacer. Shake the inhaler well. Attach the inhaler to the spacer and exhale deeply. Purse the lips around the mouthpiece and take a slow breath in. Hold this breath for at least 10 seconds. Wait 2 to 3 minutes. Repeat the process. Rinse mouth after use if using a steroid inhaler. In addition to COPD, there are other pulmonary diseases that are related to it. Both emphysema and chronic bronchitis are all quite similar. This is the end of the presentation. At this point, please navigate to the exam and complete it to the best of your abilities.